Hi, my name is Dr. Kira Gecht, and I'm a dentist from Sarasota, Florida. My office, Simply Smiles, is located just right off Stickney Point Road. So I'm here to answer all of your questions about tooth extractions. Yeah, I get this question all the time. Patients ask me, what is the tooth extraction? Well, let's talk about what word extraction means. It means that we extracting. We taking something from tooth. We can extract the tree, but that's basically what it is. So tooth extraction is exactly what it says. Unfortunately, oftentimes tooth is so broken down that it cannot be saved. And despite my best effort and my team best efforts, we have to come to a very, very regrettable decision to recommend the tooth to be removed. There are multiple reasons why tooth extraction is recommended or required at this point, because we just don't recommend like things like that very lightly. We take it very seriously and we fight for every tooth. But sometimes when the cavity is very deep and there isn't enough tooth to restore it to the original condition, then the best thing is to cut our losses, unfortunately, and have the tooth removed. That's one of the reasons. The second most common reason is, unfortunately, also gum disease. And I hope you guys are brushing twice a day and flossing, and most importantly, see a dentist. Let us take care of you, okay? Because gum disease is silent. It kills the gums, kills the bone that supports the tooth. It is heartbreaking for me and for all of the doctors that are in my practice to look and go, gosh, this is a preventable situation. This is something, have it been handled earlier, we could have saved the tooth. So what happens during gum disease? There is no bone. See, bone is gone. The tooth is like this. Sorry. And I gotta remove it. I have no choice. So help yourself and let me take care of you. There are the most common types of tooth extraction. Basically, sometimes it could be quite simple, and it's going to be, as we call, surgical extractions. And the big difference is how difficult it is for the doctor to remove the tooth. So simple extraction, not that difficult. Surgical extraction, yes, we gotta have to really get some muscle behind it and take the tooth out. I wish it wasn't like that. Also, there's another type of extraction that we sometimes recommend, and sometimes it also can be of basically more of a proactive preventative reasons. We as species evolved, and listen, we used to eat a lot more meat. Maybe our jaws were bigger. So we designed to have 32 teeth, and there's some people who have more than that. Not me. Everybody talking about wisdom teeth. Sometimes those wisdom teeth just don't have the room. And removal of the wisdom teeth, the sooner the better. Why? Because we don't want to compromise the other 28. So sometimes you gotta cut your losses and go from 32 to 28. I also get referrals from an orthodontist when the mouth is just not big enough to house all the teeth. And sometimes during braces, we have to remove some extra teeth to create room to give us the best functioning mouth. And that's when the extractions are done kind of electively due to not enough room. And during the braces, that happens sometimes. So when we prescribe tooth extraction, that does not really have the age or any kind of other factors. And unfortunately, sometimes someone who can be very young need to have a teeth removed for multiple reasons. Sometimes it's because, listen, the cavities just took over the tooth. My only recommendation, and I had this conversation with my patient the other day, is that depending on the age of the child, sometimes you got to put a special device to keep the space of the baby tooth. Because once that baby tooth is gone, all the other teeth are going to start migrating and shifting, and then it creates a bigger problem when they're older. So do ask questions. Ask questions to your dentist. Be curious. this is your child's health. Tooth extractions considered oral surgery because, again, we surgically, as dentists, remove part of your body. Just like any other surgery, if you get an appendix removed, that's a surgery. When you have a tooth removed, yes, you're losing part of your body. It is an oral surgery. I get in my practice sometimes calls when people call and go, God, I have a horrible toothache. And sometimes the toothache don't really work 9 to 5. It could be after hours. So when you have an emergency tooth extraction, call your doctor, call the doctor that might be on call. But again, to me, the sooner the better. Oftentimes, for some patients, it's advised to be completely put to sleep during the extraction. That really depends on the person and also depends on the situation, how complex the extraction is. Sometimes you don't need to be put to sleep. Sometimes it's highly advised to be put to sleep. We dentists always recommend to keep the teeth clean as much as possible after the extraction. But there are going to be some modifications. We don't advise to use a hard brush in the area where the tooth has been removed. And also, you don't want to be swooshing around, spitting right after the extraction. Usually, you want to wait at least 24 hours. I have a written instructions for my patients with a lot of questions answered with them. And it's very, very specific. So when you come in, I want to make sure that we answer the questions. We're going to show you how to take care of your site where the tooth was removed, and also give you some, helpful tips on how to take care of your mouth after the dental extraction. As much as we dentists trying to prevent any kind of complications, they do happen. And the most common complication after the tooth extraction is what we call a dry socket. So here's what dry socket is. To be able to have a proper healing, you gotta have a blood flow. But sometimes that blood flow is compromised, and that's what dry socket is. So one of the tips to avoid the dry socket would be to make sure that if people are smoking, don't smoke after the extraction, don't spit for at least 24 hours. Unfortunately, you have to just let the stuff drool out. I know it's not sexy. I know it's not what you want, but you don't want to dry socket. And of course, when something doesn't feel right, just call your doctor. Get in, let them take a look. Also, early detection is helpful. The average recovery process from the tooth extraction could be anywhere from a day or two to up to a week. It depends on the complexity of the case. Simple might be just a day. Something that's more complex might take a little bit longer. Thank you for attending my little presentation about dental tooth extractions. I hope you learned something about it. I'm sure now you have more questions. So guess what I want you to do? If you have a question, just call our office, make an appointment, and I can answer them more in person. And if you have more questions, you call again. My name is Dr. Kira Gecht, and I am from Sarasota, Florida. My office number is 941-921-4654.